Hello, my name is Mike McLafferty. I'm the CEO and founder of MJM Advisory and Educational Services. Welcome to our weekly current event update. This week we're going to focus on the American Rescue Plan, in particular some of the key healthcare provisions in the plan. On the healthcare side, money is being allocated for vaccine distribution, testing, dollars are going out to providers in rural communities, additional money for access to healthcare insurance for individuals, and there are a number of policy adjustments to Medicaid program in this bill. First, we're going to start out with public health financing. In this section of the bill, there is $7.5 billion that is going to go to the Centers for Disease Control and Prevention. The money is to be spent to help plan, promote, track, distribute COVID-19 vaccinations and testing. The next section is relief for providers of healthcare in rural communities. There's $8.5 billion going to these providers. So these different entities that are out in the rural communities who are servicing Medicare and Medicaid beneficiaries will benefit from these funds. The next section of the bill we want to talk about is funding for mental health and abuse use. There is $3 billion in block grants going out to state and local governments to combat these particular issues. The block grants are helpful in that it provides a lot of flexibility for the state and local governments on exactly how they want to spend their money in these areas. The next section, which has gotten a lot of press probably within the last few months, and a significant portion of the bill, has to do with funding for state, local governments, tribal governments, territories. The total amount of funding in this section is $350 billion. $220 billion is going out to state, territory, and tribal governments. $110 billion going out to local governments. So this is a significant area of funding. A lot of these different governmental entities, as you know, have been hit with a combination of increased costs during COVID and obviously a lack of revenues because of the hit to the economy in these areas. Next section that we want to talk about is mandatory coverage for COVID-19 vaccinations without cost sharing. So all state Medicaid and CHIP, that's the Children's Health Insurance programs throughout the country, they cannot cost share when somebody comes in for some sort of treatment, any kind of preventive type issues relative to COVID. And this stays in effect for approximately 1 year after the current public health emergency ends. Next section we want to talk about is coverage of pregnant and postpartum women. For states here, they have the option, if they want, for women in Medicaid or CHIP programs to extend healthcare coverage up to 12 months after the birth of a child. Next section is COBRA premium assistance. This is a federal insurance federal law that allows you to continue your insurance from an employer after you've lost your job. This can be very expensive for somebody because the employee has to pay not only their portion of the premiums, but also the employer's portion. However, under this bill, through September 30th of this year, 2021, the bill will pay for the entire premium for an employee. So there's no cost to the employee for COBRA through September 30th of 2021. The federal marketplace, which is utilized for people who are interested in getting coverage under the Affordable Care Act, typically the premiums are subsidized by that bill up to 400% of the federal poverty level. The American Rescue Plan will provide additional assistance for people above the 400% of federal poverty level on a sliding scale. Thanks for watching our current event update. We look forward to seeing you next week as we pick a topic out that is of critical interest to the healthcare industry.